Okay, so in this video we're going to see the structures of the heart. So the heart is this organ of the circulatory system that helps to pump the blood into our body or into our lungs. So within the heart we have 4 chambers, 2 superior ones that are called the atria, and then 2 inferior ones that are called the ventricles. So the heart is separated by a septum that separates the heart into the right side and the left side. So we have the interatrial septum, so the one that separates the right and the left atrium, and then we have the interventricular septum that separates the right and the left ventricles. Now this is the external structures of the heart. So this is the anterior view. So within the anterior view, we can see the shape of the heart, which is conical, and the heart has a base, which is this, and it has an apex, which is this. And the heart tilts like this way in our thoracic cavity. So the base is a little bit superior, facing towards the right, and then the apex, it's inferior, pointing towards the left. And specifically, the apex will be located at the mid-clavicular line, 5th intercostal space at the level of the nipple. So within the base of the heart, we have the attachment of the great blood vessels, which will be the following. So this is the aorta, this is the pulmonary trunk, this is the superior vena cava, and in here, this is the inferior vena cava. So these are what we call the great blood vessels. So inferior vena cava, superior vena cava, aorta, and pulmonary trunk, and they are located at the base. Now, within the anterior view, you can see, like I mentioned before, the atria, the right atria, the left atria, the right ventricle, and the left ventricle. And the atria, they have a tiny appendix that is called the auricles, which will be like these ones in here. And in between the atria and the ventricles, we have an indentation that it is called the Interventricular Sulcus. Within this Interventricular Sulcus or Coronary Sulcus, we have these blood vessels going in here. These blood vessels will be the blood vessels that provides blood supply to the heart. There are branches of the aorta, the ascending aorta. So this is the part of the aorta that goes up that is called ascending. So this will be the right coronary artery running in between the right atrium and the right ventricle, and this will be the left coronary artery running between the left atrium and the left ventricle. Now, in the anterior view, there is also an indentation in between the right ventricle and the left ventricle. This indentation is called the interventricular sulcus. And in the interventricular sulcus, you have the running of the anterior descending artery, okay, or anterior interventricular descending artery. It's more commonly known as anterior descending artery or ADA. And this ADA is branch of LCA, left coronary artery. And then we also have this vein that is called the great cardiac vein. Now, this is the right margin of the heart, this is the left margin. And here, within the right margin, we have this artery that is called the marginal artery, and then we have this vein that is called the small cardiac vein. So this is the small cardiac vein, and this is the great cardiac vein. Okay, and then this in this part of the heart, we can see the beginning of this artery that is going to bring the blood from the right ventricle into the lungs, which is the pulmonary trunk. The pulmonary trunk, when it reaches the hilum of the lungs, is going to split or bifurcate into right pulmonary artery to provide blood supply into the lungs so that the lungs can oxygenate this blood. So this one carries deoxygenated blood because the right side of the heart handles only deoxygenated blood or CO2 rich blood. And this pulmonary trunk then divides in the hilum of the lungs into right pulmonary artery and then left pulmonary artery. So they provide blood supply to the left and right lungs so that you can oxygenate this blood and return it into the heart to the side of the heart that handles oxygen-rich blood, which will be the left. Specifically, the pulmonary veins, they are going to drain the blood. So veins will drain the blood into the left atrium, which is this. So the oxygenated blood, which is depicted here with red color, comes into the left atrium through these two left pulmonary arteries and two right pulmonary arteries. So veins, they drain or empty blood into the heart, and arteries delivers the blood out of the heart. So these will be left pulmonary veins, two, and two right pulmonary veins that drains blood, oxygenated blood, into the left atrium. When this blood fills the left atrium, the blood is going to be pumped into the left ventricle. And this blood from the left ventricle is going to go into the body to provide oxygen to our cells via this artery, the main artery in our body, which is called the aorta. And the aorta has different segments. So it has this first segment that is called ascending because it goes up, and then it has this arch, which is called the aortic arch, and then it will go down posteriorly in the heart, and now it's going to be called thoracic descending. And when it pierces the diaphragm, it goes into the abdomen, it's going to be called descending abdominal aorta. And out of this aorta, all of the arteries in our body will be formed. Like in this case, for the aortic arch, will be the common carotid, the right common carotid, the left common carotid, and the left subclavian, which is this. Now, so these are the structures then that you can see in the anterior view of the heart. Now, in the posterior view, you can see the left atrium, the right atrium, the right ventricle, the left ventricle. And then you can still see the atrioventricular sulcus, and then the posterior interventricular sulcus. Now, here within the posterior interventricular sulcus, atrioventricular sulcus, what you can see is how this great cardiac vein follows up from the interventricular sulcus into the atrioventricular sulcus, goes and runs and empties in here into this dilation of this great cardiac vein that now is going to be called coronary sinus. So when the heart receives its blood supply through the RCA, the right coronary artery, and the LCA, the left coronary artery, and uses all the oxygen, it will produce the oxygenated blood that is going to be emptied mainly into the great cardiac vein, and then into this middle cardiac vein, and then into this small cardiac vein, and then empty into this dilation, which is called the coronary sinus. Now, the coronary sinus will empty either into the inferior vena cava or directly into the right atrium. It can be one or the other. Now, here, this left coronary artery, as it's going towards the left, following this atrioventricular sulcus, is going to change its name from left coronary artery into circumflex, which is this. And then in here we have the posterior descending artery, or PDA, or posterior interventricular artery, that runs in this posterior interventricular sulcus together with this median or middle cardiac vein. Now, another thing that you can see here in the posterior view is, besides the inferior vena cava, the superior vena cava. So inferior vena cava is going to drain the blood from the arm and below, and it will empty into the right atrium. And then the superior vena cava is going to drain the blood from the upper part of the body. Whatever the inferior vena cava don't drain, this one will drain. And then both of them, they will empty their blood into the right atrium. Now, the heart itself has a wall that is made of 3 layers. So the outer layer, that it is not shown in here because this is a model, but it's made of a membrane, a double membrane that is called the epicardium or pericardium. So we have the membrane that closely attaches into the heart, which is called the visceral pericardium. And then we have the parietal pericardium or epicardium that is outside the visceral pericardium. And in between, there is a space filled with pericardial fluid that it is produced at a certain amount and absorbed at a certain amount every day. So that's the outer layer of the heart, then the pericardium. And then the middle layer, which will be this, the muscle layer, will be the myocardium. It's made out of cardiac muscle cells. These cardiac muscle cells are 24/7 contracting under the influence of the pacemaker cells of the heart and the autonomic nervous system, or ANS, sympathetic and parasympathetic system. And then the inner layer of the heart will be the endocardium. The endocardium is made out of simple squamous epithelium, and it is continuous with the endothelial cells of the blood vessels, which is also made out of simple squamous epithelium. So from outer to inner, then the heart has pericardium, myocardium, and then endocardium. And the thickest layer will be the myocardium. Now, if then you see the internal structures of the heart, so you will see in the chamber. So this is right atrium again, receiving blood from SVC and IVC, superior and inferior vena cava, from the body, deoxygenated blood. And then the blood will pass from the right atrium, so this atrium will contract, and then it will pass into the right ventricle. But before it passes through the right ventricle, it will have to pass through this valve that is called the right atrioventricular valve, or tricuspid, because it has 3 cusps or 3 leaflets. Okay, so this is the tricuspid. And then the ventricle, the right ventricle, will pump the blood. It will contract during systole. That's the name of contraction of the heart, systole. So it will contract and push the blood into the pulmonic valve. This is a type of valve that is called semilunar, because it has the leaflets that looks like half moon shape, which is this. Semilunar valves always have 3 leaflets, and they have this shape of half moon. And when the blood is pushed from the right ventricle into the pulmonic semilunar, it will go into the pulmonary trunk. Now, the function of these valves in general is one-way, to allow one-way flow of blood from upper chambers into lower chambers, or from proximal to distal. So when the blood passes from the right atrium into the right ventricle, the blood shouldn't back up. So only will pass from atria to ventricles, or from ventricles into blood vessels. In this case will be pulmonary trunk. Now, in the left side, we have the left atrium, and then we have the left ventricle. So the blood will pass from the left atrium into the left ventricle, passing through this valve, atrioventricular valve, which is called the mitral or bicuspid. It's called bicuspid because he has two leaflets. And the leaflets of these valves, the atrioventricular valves, are hauled into these muscles that are called the papillary muscles. And the papillary muscles will connect into the leaflets using these strings of cords that we call chordae tendinae. So these are ligaments made out of collagen fibers. Because when the ventricles contract, these leaflets, they tend to go up into the atria, like if it was an inside-out umbrella during a windy day, and they have to be brought back into the ventricles. So when these papillary muscles contract, they create tension in these valves, in these chordae tendinae, in these ligaments, and they pull the flaps back into the ventricles so that they don't stay there within the atria where they shouldn't be. That's not their normal position. So this mitral has two leaflets, and then the blood, once it fills the ventricle will contract the left ventricle and will push the blood up into the aortic valve, which is this. That's the inferior view, and this is the superior view. So that the blood will go from the left ventricle into the ascending aorta, and then into the aortic arch, and then into different branches. Okay, so when these two atrioventricular valves contract, when these two atrioventricular valves closes, after ventricular contraction, it will produce a loud sound that we call the S1, or love sound, during contraction of the ventricles. Now, when the ventricles empty their blood into the pulmonary trunk or into the aorta, these semilunar valves, the pulmonic valve and the aortic valve, will close, and then you produce the second sound of the heart, which is S2, or the dub sound. So love dub, love dub. So closure of AV valves and closure of semilunar valves. That will produce the sounds that you can that you can hear in auscultation of the heart. Now, in general, the walls of the atria are smoother than the walls of the ventricles, the inside wall. Okay, so, but in the right side, more than in the left, we have these tiny muscles in the right atrium that is called the pectinate muscles. So these are projections of muscles towards the endocardium. So these will be the pectinate muscles. Now, in the ventricles, these muscles are, or this projection of muscles are more pronounced, more prominent, and these will be called the trabecular carni, all of these. So these are the papillary muscles, and these will be the trabecular carni. So the surface inside the ventricles, it is rougher than in the atria. Now, this is the apex, the internal view of the apex, and then this will be the interventricular sulcus, or septum, sorry. This is the interventricular septum. So the interventricular septum separates the right and the left ventricles, and then in here we have the interatrial septum that separates the right and left atrium. Now, during fetal life, there is communication between the right side and the left side of the heart, in here in the right atrium and the left atrium, and this is called the foramen ovale. And once we're born and we have our first breath, we close this, and now it's going to be called the fossa ovale. Now, there shouldn't be any communication after we're born between the right and the left side of the heart. And sometimes there is a hole here because the septum is formed from the apex up to the base of the atria. So there is this hole that it remains in here in between the right and the left ventricle. It's called the ventricular septal defect. If the hole is big, there's a lot of blood going from the right side into the left side, which is deoxygenated blood into oxygenated blood. and then the person needs to have surgery right away because the blood in here will be so diluted of oxygen that the tissues in your body won't be able to tolerate this. But if the opening is small, there is not so much problem. You can leave some time to see if it closes by itself, or if it doesn't close, you can have optional surgery, or you can live with a tiny shunt of blood from the right side into the left side, and there's no problem. The only thing is that when you have a small opening here in the interventricular septum, as the blood is passing or shunting from the right to the left, there is going to be a lot of friction of the blood against this opening, and it's going to create a loud murmur. So hearing a loud murmur in someone with ventricular septal defect is not so bad, because very little blood will shunt from the right into the left. That is when the gap in here is very big. So in that case, the person has to have surgery right away. Now, occlusion of these, lastly, of these coronary arteries, any of them or its branches, will lead to lack of blood supply into different areas of the heart, and then that will lead to necrosis of the cells, cell death, abnormal cell death, and this is called myocardial infarction. Now, if the occlusion is complete, then that person will have myocardial infarction. If the occlusion is partial, the person will have pain in the area of the heart, which is called precordial, and then the person will have what we call angina pectoris. And then the heart contracts because it has specialized cells that you cannot see here, but it's called the conduction system, which is the SA node, which is found in here, and then the AB node, which is found in here, and then it has an AB bundle, which is here, and then the bundle branches right and left, and then the Purkinje fibers that goes up in here. So these are specialized cells that transfer electric action potentials from SA node to AB node to AB bundle to bundle branches right and left, and then to Purkinje fibers. And these electrical signals, action potentials, stimulate the cardiac muscle cells to contract so that the heart can pump the blood into the body. So this is all the structures of the heart, and I will see you in the next video.